At Rocky Mountain Regenerative Medicine, we've certainly done stem cell therapy in the pediatric population. It's a population that we're um, pretty comfortable in interacting with, in treating. When those individuals come in, when they're brought in by their parents, the typical injury that's prompting that visit tends to be cerebral palsy, some sort of a hypoxic, anoxic brain injury incurred around the time of birth, or maybe it was in utero. Sometimes it's rare, but it's also possible that those types of hypoxic injuries occur after being born, and unfortunately, something led to damage to neurons of the central nervous system in the brain and the spinal cord, and certainly there's genetic issues that may have led to some form of a neurologic impairment. And when those individuals were brought in, typically we have a really thorough conversation with the parents beforehand, sort of explaining what we do. And I want to address some of those most commonly asked questions here in this video. But once they're here, the day of the procedure, we usually, after answering some last minute questions, we go back to the procedure room. We really prefer that the parents are there with us. And that's really helpful for us. I know that there's in a conventional medical setting, sort of families are separated. We find that the opposite is actually really, really helpful in taking care of the patient. There's subtle cues with regards to some of these kids that are picked up by the parents that we may be entirely oblivious to. And so we start the procedure by administering a small amount of a sedative called ketamine, and we administer that sedative intramuscularly, either into the buttock or into the thigh. And once the patient becomes really sleepy, and they can tolerate placement of an IV, we do so with help from our nursing staff. And sometimes if there's a difficult IV, if that access is somewhat challenging, we do use ultrasound to help us out. And then if there's more sedation that's required, usually it's administered through that IV. And again, we tend to use ketamine for that. We certainly have access to other medications, other agents, but tend to gravitate towards ketamine for a number of reasons. It's generally much safer to administer. And additionally, there's this unique feature with respect to ketamine in that it helps rewire the brain. It helps form new connections between existing neurons, and that's certainly something that's preferred when we're trying to address underlying pathology that stems from damage to neurons and lack of adequate communication, that sort of thing. So once we administer the ketamine, the goal is going to be to access that area of the body that has a rich source of stem cells. And again, our objective in that regard is to get to the lower buttock or lower back, upper buttock region. And so with some help, we help turn the patient onto their belly. We clean off that area, the lower back, upper buttock area really, really well. We anesthetize it with subcutaneous lidocaine that's been diluted. And so it covers a large geographic area. We make a couple of incisions, go in through those incisions with an instrument to acquire the fat. And then once the fat is extracted, at that point, we have a couple of options for how to proceed. One of them is to take that fat and send it to our lab where the stem cells are separated from the fat. And over the ensuing several weeks, those cells are replicated to really high numbers and then reintroduced into the body. I'll go into detail about how those cells are reintroduced. But the other option is to take fat and isolate the cells that same day without that 3 to 6 week waiting period during which the cells are being multiplied. And so we refer to that as a same day procedure. And a same day procedure is really pertinent in cases where the families are traveling from afar and they don't want to have to wait 3 to 6 weeks before the patient sees their own stem cells for the first time. And so that same day procedure can be, as the name would suggest, done that same day. But the limitation there, the difference between that and banking, is that the number of stem cells are far lower because they've yet to be replicated. So that's obviously really understandable. There's some advantages where there are certain proteins in fat that work in conjunction with stem cells when they're in their natural environment. Those are certainly going to be included in that same day procedure, whereas those are not present with the banking procedure. And so that's one difference that really augments the effectiveness of a same day procedure, where it's not significantly lacking compared to a banking procedure based purely on the number of stem cells. So there's certainly a role for a same day procedure. As opposed to the advantage decisively going to a banking procedure. The other thing is if as occurs in the vast majority of cases that we treat, patients do improve. Patients do get better, and so those individuals will have to come back at a future date for another stem cell injection. Maybe that's the preference of the parents because they want to continue that trajectory. They want to continue that improvement. Well, if there are no bank cells, then we're looking at another liposuction procedure of the type that I just described. So those are kind of the differences between same-day procedures and a banking procedure. There's a lot of similarities, but the big difference is with a same-day procedure, you're getting the cells that same day, albeit at a lower number. However, there are proteins there that augment the effectiveness of those limited number of stem cells. The big advantage of a banking procedure, in addition to a higher number of stem cells, is that in the future, if there's additional deployments that are requested because there's been positive results, it negates the need for another liposuction procedure. So that's sort of the big advantage of stem cell banking. And we've certainly had patients come back 6 months later, a year later, 2 years later, wanting more and more of their stem cells. As long as they're banked, you're really not taxing that source. Some of our patients have used a number of vials, which is how these cells are stored, of their stem cells. And it's really difficult to run low on the supply there. At some point, it's certainly possible to run out of those stored cells, but it's yet to happen. And we've had patients that at this point have used multiples of the number of similar cells found naturally in the body. So it's a lot. It's a lot is the bottom line. And then the question that sometimes will come up, well, how do you administer these cells? Something that I briefly alluded to earlier. And we administer them intravenously. I know that there are clinics out there that administer these cells intrathecally, meaning directly into the spinal canal. And I would say that's really, really dangerous. There's been a lot of cases of seizures, headaches, neck pain, back pain, fevers that develop in the context of those types of injections. And some of them can be certainly life-threatening. They can be debilitating. It can lead to a lot of morbidity over the long haul. And so I just don't think it's safe. And then the question is, it'd be one thing if it was worth a significant difference in outcome, but it's not. The methodology that we've used, that we've devised, has worked really, really well. And when we deploy these cells, we do so intravenously. So the cells, in other words, are reintroduced back into a vein in the arm. And then it's done in conjunction with a sugar called mannitol. And the unique thing about mannitol is that mannitol helps shrink these cells that comprise something called the blood-brain barrier, which is this natural separation between the blood and the central nervous system that we've developed more to augment, to help our immune system. But it keeps out these stem cells from an area where they may be needed to bring about regeneration, to bring about healing, such as the brain after a hypoxic brain injury, for instance, or a concussion or what have you, or spinal cord injury. And so we want these cells to obviously respond to chemical signals of injury that are being released by those cells, by those neurons that have been damaged on the other side of the blood-brain barrier. And that is something that mannitol helps make happen. Mannitol doesn't remove that barrier indefinitely. That effect is pretty temporary, but allows these cells, as long as they're present in really high numbers, to cross to the other side and help bring about the type of healing and regeneration that we're after. So in a nutshell, that's how we do stem cell therapy. I know there's other variations, including I mentioned the intrathecal route, which comes about, introduces its own set of dangers. The other thing to keep in mind is a lot of, at least from my experience, from my conversation with other clinicians as well as parents, there's certain procedures that I think are erroneously referred to as intrathecal, when in fact they don't entail introduction of these cells into the spinal canal as you might think. I think when a lot of people hear that term, they appropriately believe the intrathecal injection to be very similar to an epidural, for instance. And from my conversation with other clinicians, with other parents, it turns out that a lot of these clinics are injecting these cells essentially subcutaneously, under the skin, near the tailbone, and that's really not an intrathecal injection. We certainly treat adults here. And in order to access that part of the spine through the tailbone, it takes imaging. You certainly can't do it blindly without ultrasound, without X-ray. And so there is such an injection where you're injecting these cells, or you're injecting a medication intrathecally through the little holes in the tailbone. But these stories that I hear about stem cells being injected completely blindly through that area in kids, it doesn't make a lot of sense to me. It's not an intrathecal injection in a medical sense. Even though they're being touted as those types of injections, they're more subcutaneous injections, and you're really relying on the ability of those cells to then cross the blood-brain barrier, which is a significant ask. So, and then, speaking of subcutaneous or intramuscular injections, I've certainly heard stories of clinics doing that in the thigh, for instance, or in the shoulder, where stem cells are injected with the expectation of them migrating to the central nervous system. And the likelihood of that happening are pretty low. I've also heard of intranasal injections of stem cells, and we've certainly done it in the context of a parent being adamant in requesting that. But I've told them the same thing that I'll say here, which is, there's certain medications that are certainly absorbed through the intranasal route, through the sublingual route where they're placed under the tongue. But the way that works is those medications are much smaller in terms of molecular size compared to a cell. And then they also are absorbed not through the brain directly, but more so through the mucosa. There are blood vessels underneath the tongue that are really close to the surface that I'm sure, you can see yourself in the mirror. The same pertains to blood vessels in the nose. And if you inject a small enough molecule in that area, they'll certainly be picked up by the vasculature, by the blood vessels. But if you expect cells to cross over to the other side, again, I think it's a big ask. Is it possible? Maybe, but cells are really much bigger than medications, and they're not going to be there. There's a natural barrier that occurs that's present at the very top of the nose that prevents migration of cells and bacteria from the nose into the brain. Otherwise, it would be catastrophic. Imagine coming up with this concept of the blood-brain barrier and then leaving one critical gap, which is right in the nose. And so it doesn't make theoretical sense, and it's certainly not true from a medical perspective. And so those are some of the alternatives that are out there. I really believe strongly in the methodology that we've devised and come up with. And so that's the form of stem cell therapy that we do at our clinic that pertains to some of these brain injury patients, hypoxic brain injury, anoxic brain injury, concussions, spinal cord injuries, pathology involving the central nervous system. And it doesn't work in every single case, but in the vast majority of cases, there are results that come about that are positive, that warrant these parents traveling back even from really far away places that I'm always in awe of. But that's the way that we do this form of therapy. There's certainly other options available that I'm glad to go into more detail. But I just wanted this video to truly focus on stem cell therapy as it pertains to what I just discussed.